Senator Walsworth for a question.
Apologize, I was at another committee doing a bill over there. I have struggled with this one. When I first came in the legislature, I was against school-based health clinics. But it has made an unbelievable difference in my area, especially in the poor areas of my district. Kids are going to school. They're getting health care that they had never gotten before. The attendances probably were, for some kids, were in the low 70%. They're probably in the 95% attendance now because they're getting the things, and they've got a nurse there, and it's local people doing this. I guess I'm most distressed to my pro tem that our own paperwork seems to have said, and I'm going to ask him to look at that last part. I do have a problem. I don't like the Bright Futures guidelines. I didn't like that. And I appreciate, I was sort of, with an iPhone, you can sort of listen to what's going on a little bit here. And I appreciate your amendment to sort of get us out of that part, I believe.
That's the first accolade I've received today.
Thank you. Maybe the last. No, I'm just kidding. I'm kidding. But this is our document? This is from the state?
No, that
Where's
is a
that from?
report. It is a report that was done on school-based health clinics that included one of the programs in Louisiana, and
Okay.
that's from Louisiana. I have the full report. I don't belong to an organization in which I can print freely. Everything
That's
I
okay.
print is
Yeah,
out of
and I
my
get that part.
pocket. But I can send you that full report where you can read the whole section of that. And I would like to mention, I am not saying anything against school-based health clinics. That is not the intent here. The intent here is to say we need to be careful when we pass these laws, that there are many more components to these laws, and you simply are opening the door when it is not necessary. We have Medicaid. If we're talking about the at-risk community, they get help via, they're reminded, as a nurse here, she's well aware of that. As someone who works in those areas with certain parents, I know that they get as well. I also know that some of the data connections here in our state, we actually connect birthing to vital statistic records, and we contact the parent, the birth mother. We are linking this data, and I think we need to be very careful when we start linking data
I think
like
it's
that.
a little unfair for me today and I'll sort of throw this back to my chairman. I hate to do this to you. I'm assuming we do not have someone from the Louisiana Office of Public Health here, do we? I'd like to know if that's their policy. If that is their policy, then I'd like to know about that before I voted on this thing. So we still have a couple, 3 weeks left in this session, or maybe I think it was 3 weeks yesterday, day before yesterday. So I don't know if we're going to have another meeting or not, but as of right now, I don't have anything that tells me this is not their policy, but I'd like to hear from them to see if it is their policy. If it's their policy, then I'd like to know why they're trying to link the data, because I think I have a problem with linking the data. And I think you did I think the amendments that I heard seems like we got rid of that part, but it looks like we still have a problem with data linking. So I'd like to, if the pro tem would allow us to talk about this next week or at the next meeting, I'd like to do that, because right now I couldn't vote for this bill like it is right now. Thank you.